Throughout this debate, the affirmative has focused on the immediate benefits of these facilities. They have argued that supervised injection sites provide protection from fatal overdoses, reduce the spread of HIV, and increase opportunities for recovery. However, the negative side of the argument has shown that these claims do not address the central issue, the addiction itself. We agree that addiction is often linked to trauma, mental illness, chronic illness, and other difficult life circumstances that many may incur upon. But if those are the root causes of addiction, then our response should focus on treating those causes directly, therefore treating the addiction. Counseling, mental health treatment, rehabilitation programs, housing assistance, and prevention efforts all work towards helping individuals overcome addiction in more positive ways. Supervised injection sites, on the other hand, primarily manage the risks associated with continued drug use and allows for the cycle to continue. The affirmative expresses that because these facilities may prevent some overdose deaths, they automatically promote recovery, but preventing an overdose and achieving recovery are not the same thing. Recovery requires individuals to break free from dependency of the drug and its cycle, and the affirmative has not proven that supervised injection sites can accomplish that goal better than treatment-focused alternatives. The affirmative also argues that these sites reduce HIV transmission through clean needles. However, the negative side demonstrated that that needle exchange programs and public health outreach can provide clean equipment without creating designated collection locations for drug consumption. If reducing disease transmission is the goal, there are other ways to achieve it besides supervised injection sites. On the topic of community impact, the affirmative claims crime does not increase around these facilities, that we showed that concerns remain regarding neighborhood disorder, public safety, and community acceptance. Even studies acknowledge that the effects of crime are not entirely clear or proven. Government facilitators should not ignore the concerns of residents and local businesses when considering these facilities. Most importantly, remember the burden of proof. The affirmative must prove that supervised injection sites are the best solution to this problem. Showing that a policy may provide some benefits is not enough. Throughout this debate, the negative side has demonstrated that there are alternatives that focus directly on prevention, treatment, and long-term recovery without establishing locations where illegal drug use occurs. At its core, the debate asks what kind of response best helps people struggling with addiction. The negative side believes that the individuals deserve compassion, support, and access to treatment. But real compassion means helping people overcome addiction, not simply making continued drug use safer. The opioid crisis is real, and the loss of life is tragic. But the affirmative has not proven that supervised injection sites are the most effective path forward to continue to solve this problem. Because these facilities focus on the symptoms of addiction, rather than its causes, because alternatives exist to reduce HIV transmission and connect people with treatment, and because significant concerns remain about the broader impacts, we urge you to vote negative. Thank you.